Welcome to the online class on Veterinary Histology by Dr. Mansi Mehra of GNP Sir Classes. Please subscribe to the official GNP Sir Classes channel. First, let's understand what a tissue is. The term tissue is derived from a French word which means texture or weave. The animal body is composed of 4 elementary tissues. 1. Epithelial tissue. 2. Connective tissue. 3. Muscular tissue. 4. Nervous tissue. Epithelial tissue. This tissue forms a membrane and covers free surfaces and lines hollow and tubular organs and helps in absorption, secretion and excretion. According to the number of cell layers, the epithelial tissue can be divided into different subgroups. A. Simple epithelium. B. Compound epithelium. And C. Transitional epithelium. Simple epithelium. When a single layer of cells is arranged on a basement membrane is called simple epithelium. According to the shape of these cells, the simple epithelium may be of the following types. A. Simple squamous epithelium. This epithelium forms a serous membrane, alveoli of lungs, loops of Henle, Bowman's capsule, the inner lining of heart and vessels. The endothelium is a term that is used for such an epithelium that lines vessels. B. Simple cuboidal epithelium. Salivary glands, thyroid, terminal respiratory bronchioles etc. In the proximal convoluted tubule of this epithelium possess longitudinal striation at its free borders, and called brush-bordered epithelium. C. Simple columnar epithelium. They are found in the stomach, intestine, gallbladder etc. The goblet cells are modified columnar cells. D. Simple columnar ciliated epithelium. This epithelium is found in the fallopian tube, trachea. Vasa efferentia, ependymal cell, etc. E. Glandular epithelium. The alveoli of many of the glands, such as thyroid, salivary glands, sweat glands, mammary glands, etc. The picture shows the different types of tissues. Compound epithelium. These epithelial tissues are formed by multiple layers, stratified, of cells arranged on a basement membrane. According to the shape of these cells, the compound epithelium is classified into the following types. A. Stratified squamous epithelium. There are 2 types of stratified epithelium. Stratified squamous conified, skin, hoofs, horns and nails are modified stratified squamous conified epithelium and stratified squamous non-conified, keratinized layer is absent. This epithelium is present in the mouth, pharynx, vagina, anal canal, etc., where wear and tear is more and absorption is less. B. Stratified columnar epithelium. This epithelium is composed of several layers of columnar and fusiform cells. They are present only in some parts of the pharynx, male urethra, fornix of conjunctiva etc. C. Stratified columnar ciliated epithelium. Some parts of the laryngeal cavity and nasal surface of the soft palate is lined by multiple layers of columnar cells with cilia on the free surface of the superficial layer. Transitional epithelium. It is made up of 3 to 4 layers of cells. A. Superficial layer of polyhedral cells containing abundant cytoplasm. B. Intermediate pear-shaped cells with their bases directed towards the superficial layer and tips directed towards the basement membrane. And C. Next 1 or 2 layers of cuboidal cells. Transitional epithelium is found in the mucous membrane of the urinary bladder, ureter, pelvis of kidneys and parts of the urethra and therefore termed uroepithelium or urothelium. The picture shows the transitional epithelium. Blood and hematopoietic tissue. These are of 2 types: A. Myeloid tissue and B. Lymphatic tissue. The myeloid tissue produces RBC, granular WBC and platelets. These cells are phagocytic in nature. Lymphatic tissue produces lymphocytes. This tissue may be 1. Non-capsulated, Peyer's patches. 2. Capsulated, lymph nodes, thymus, spleen, lymph glands, tonsils. Sinusoids. These are dilated vascular channels lined by an incomplete layer of endothelium and basal lamina and therefore allow the blood to come in direct contact with the cells of the tissue. These are found in liver, spleen, bone marrow and in some endocrine glands. The sinusoids may connect an arteriole with a venule, e.g. spleen, and a venule to another venule, liver. Vasa vasorum. These are the vessels for large blood vessels. Arteriovenous anastomosis. By passing the capillary network, some direct communication between arterioles and venules are found in some places of the body. They are found in skin, erectile tissue of external genitalia and in G1 tract. Some such anastomotic vessels are tortuous and thick-walled and contain modified muscle, epitheliode, cells called glomus. Spleen. Spleen is the largest lymphoid organ. It forms erythrocytes in fetal life and lymphocytes after birth, and therefore it is also called a hemi-lymph organ. It filters blood and removes foreign particles from circulating blood. Framework of the organ. A. Capsule. B. Trabeculae. These are the septa extending towards the anterior. These trabeculae divide the gland into several lobules. C. Connective tissue network. There is no cortex and medulla in this organ. The pale zones which remain scattered in a red background is called white pulp, and the background red zone is called red pulp. The two major functional zones of the spleen are the hematogenous red pulp and the lymphoid white pulp. The white pulp, located around a central arteriole, is composed of the periarteriolar lymphoid sheath, PALS, T cell area, the adjacent follicles, B cell area, and the marginal zone, B cell area. The picture shows the histology of the spleen. Digestive system. Hard palate. The mucous membrane is composed of keratinized stratified squamous epithelium. Soft palate. The mucous membrane is made up of stratified squamous non-conified epithelium. The mucous membrane of the nasal surface is composed of ciliated pseudostratified columnar epithelium. Tongue. The tunica mucosa of the dorsal surface is formed by keratinized stratified squamous epithelium. The thickness of the keratinization is variable amongst different zones. Thin surface contains many macroscopic papillae which either serve mechanical or gustatory functions. These are A. Filiform, B. Fungiform, C. Lenticular, and D. Valate. Foliate papillae are found in equines and conical papillae are present on the tongue of dogs and cat. Ventral surface of the tongue. This surface is smooth and is covered by non-keratinized stratified squamous epithelium. This epithelium is highly vascular. Lissa. It is a fibroelastic cord that extends along the midline of the ventral surface of the tongue of a dog. It is composed of fibrous connective tissue, adipose tissue, striated muscle fibers, vessels and nerves. In cat, it is mainly composed of adipose tissue. In other animals, pig and horse, it remains in the form of a thin fibroelastic cord. TOOTH. Dentin. The bulk of the tooth is formed by dentin, which also encloses the pulp cavity. Dentin contains numerous parallelly arranged dentinal canaliculi in which dentinal fibers or processes extend from the tall odontoblastic cells of the pulp cavity towards the periphery in a radiating manner. Enamel. The projected part of the tooth above the level of gum is known as the crown. Crown has an external covering of hard translucent material is known as enamel. It is composed of radially arranged hexagonal rods, the enamel prisms derived from ameloblast cells. The wall of the pharynx is composed of the following layers. A. Inner mucous coat. Lining epithelium. It is a non-keratinized stratified squamous epithelium in the oropharynx and laryngopharynx and pseudostratified columnar ciliated epithelium in the nasopharynx. Lamina propria. Other than serous and mucous glands, it contains collections of lymphoid tissue. These are known as pharyngeal tonsils. Such collections of lymphoid tissue at the lateral wall of the oropharynx are known as palatine tonsils. B. Muscular coat. Bundles of ill-defined skeletal muscle fibers are arranged in a thin layer intermingled with fibroelastic connective tissue. C. Outer fibrous coat. It is a fibroelastic layer and attaches the pharynx to the surrounding structures. The general characteristics of the gastrointestinal tract. Stomach of ruminants. Out of the four compartments, rumen, reticulum, omasum and abomasum, the last compartment is glandular. The first three portions are non-glandular and are lined by stratified squamous epithelium. The abomasum is glandular and is similar to that of a simple stomach. The picture explains the layers of the gastrointestinal tract. In ruminants and dogs, the striated muscles are present throughout, whereas in horse and pigs they are present up to cranial 2/3 only and the caudal 1/3 have smooth muscles. The common features of the gastrointestinal tract are explained in this table. This table features the comparative histology of different compartments of the ruminant stomach. Respiratory system. Respiratory part. This is lined by pseudostratified columnar epithelium with goblet cells. Plenty of blood vessels, and serous and mucous glands are present in the subepithelial tissue. The paranasal sinuses are lined by simple, squamous, cuboidal, or transitional epithelium or sometimes by pseudostratified columnar ciliated epithelium with few goblet cells. Olfactory part. This is the region of ethmoid turbinate, part of the dorsal turbinate and nasal septum. It forms the posterior 1/4 part of the nasal cavity. It is lined by neuroepithelium which contains olfactory, supporting and basal cells. The olfactory cells are modified neurons, bipolar, and their axons form the bundles of olfactory nerves. Dendrites are distributed on the epithelium and serve as receptors. The supporting cells are columnar type and the basal cells are small cuboidal cells. Tubulo-alveolar olfactory glands are present in the lamina propria. Thanks for watching, share, like, and subscribe GNP Sir Classes Official. See you. Bye.